cervical spine RVMs with the help of inch tape. So before going to measure flexion, so here we have to mark, but here it is it's a nice style he is having. So here we have to mark the 1 point. So here at the center of the chin we will mark 1 point, and here we will be having sternum, mandibular sternum we are having. No? So exactly at the center of the sternal notch, we are going to mark 1 point. So 2 points are there, center of the chin and center of the sternum we are having, 2 marks we measure. So after that we are going to, first we are going to see, this is neutral position of the patient. First we are going to measure the distance between, center of the chin to the sternal notch. So here somewhat I got 14 centimeters. So after that we are going to ask patient to touch your chin with your sternal notch. So he has to flex. How much he can able to flex, that he will flex. So here completely he touched, Some patients they will be up to here, they can't touch full. So that time we are going to measure the distance between center of the chin to the sternal notch, Then now we will see cervical spine extension. This is the neutral position. To check cervical spine extension, simply we'll ask patient to extend. When patient extends his neck, so we are going to measure the center of the chin to the sternal notch, the distance. Okay, this is cervical spine extension with inch tape. Now we are going to measure the lateral flexion. Okay, before measuring lateral flexion, here this is our acromion process. We have to make 1 mark lateral to the acromion process. 1 mark we should make here, and here we will be having mastoid process. Here also we should make 1 mark over the mastoid process. So while patient is in neutral position, first we are going to measure the distance between this mastoid and acromion, and we will record that. After that we will ask patient to do lateral flexion, how much he can. Okay, how much patient can do lateral flexion, that patient will do. Again, relax. Okay, that's it enough. Okay, after that we are going to measure the distance between lateral, what is this? Mastoid, and here we are going to measure the distance between acromion and mastoid. So this is the way to measure lateral flexion of the spine with inch tape. Now we have to measure the rotation. Okay, this is our rotation movement. So how to measure rotation? So first we are going to see, here already we marked the center of the chin. So we are going to take the distance between center of the chin to the acromion. We will take the distance. After that we will ask patient to do rotation. Patient will do cervical rotation. Once patient does rotation, then we are going to take the distance between center of the chin to the acromion. This is the way how we will measure cervical spine rotation with inch tape. Clear?